Two people can both have arthritis, but one may need pain control while the other may need treatment to stop the immune system from damaging the joints. Today, we're going to explain the difference between osteoarthritis and rheumatoid arthritis in simple words. I'm Dr. Alvarez, a rheumatologist. I help patients understand and manage arthritis, joint pain, and autoimmune diseases like rheumatoid arthritis. Many people hear arthritis and think it's all the same, but it's not. By the end of this video, you'll know who gets each condition, how their symptoms differ, what we look for during exams, what blood tests and x-rays reveal, and why treatments vary significantly. Let's start with the basics. Arthritis means there's a problem inside a joint. The cause of that problem is what distinguishes these two diseases. Meet Maria, a 63-year-old. Her knees hurt when she walks. They ache more at the end of the day. Resting helps, and her morning stiffness lasts about 10 minutes. This fits osteoarthritis. Now meet Daniel, who is 45. Every morning, his hands are stiff for over an hour. His knuckles are swollen, and he feels exhausted. This sounds more like rheumatoid arthritis. Same word, very different disease. Osteoarthritis is the most common type of arthritis. It usually affects people over 50. Risk factors include aging, previous joint injuries, excess weight, and years of joint use. Think of it as a wear problem. The cartilage, the cushion inside the joint, thins over time. Less cushion means more friction, and more friction can lead to pain. Rheumatoid arthritis, however, is an autoimmune disease. This means the immune system mistakenly attacks the joint lining. It often begins between ages 30 and 60, and it affects women more than men. This is not wear and tear. It's inflammation driven by the immune system. Now, let's compare symptoms. Osteoarthritis pain worsens with activity, like walking or climbing stairs, but rest helps. Morning stiffness is brief, usually under 30 minutes, and it often affects the knees, hips, spine, or finger joints, sometimes more on one side. Rheumatoid arthritis causes inflammatory pain, with morning stiffness lasting over 60 minutes. Joints are swollen, tender, and sometimes warm. It usually affects both sides of the body, especially the hands, wrists, and feet. Fatigue is common, and it can be significant. On physical exam, osteoarthritis joints feel firm or bony. There may be limited motion or a grinding sensation. Swelling is usually mild, and hard bony bumps can develop in the fingers. Rheumatoid arthritis joints feel soft and swollen. They are tender when pressed, and grip strength may be reduced. Untreated, long-standing RA can lead to joint deformities. Blood work also differs. In osteoarthritis, blood tests are typically normal. Inflammation markers like ESR and CRP are usually normal. Rheumatoid factor and anti-CCP antibodies are usually negative. In rheumatoid arthritis, inflammation markers are often elevated, and many patients test positive for rheumatoid factor and anti-CCP antibodies. This supports the diagnosis. Imaging reveals key differences between osteoarthritis and rheumatoid arthritis. In osteoarthritis, X-rays show joint space narrowing. This happens because of cartilage loss. X-rays may also show bone spurs and thickened bone. These are mechanical changes. In contrast, rheumatoid arthritis may also show joint space narrowing, but it can include bone erosions and soft tissue swelling, often symmetrically. This reflects inflammatory damage. Treatment is where the differences truly matter. Osteoarthritis treatment focuses on symptom control and function. Exercise strengthens the muscles around the joint. Weight loss reduces stress on the joints. Medications may include acetaminophen or NSAIDs. Topical treatments and steroid injections may also provide relief. In severe cases, joint replacement surgery may be necessary. Rheumatoid arthritis treatment aims to control the immune system and prevent permanent damage. We use disease-modifying anti-rheumatic drugs, also called DMARDs. Methotrexate is often the first-line option. Biologic medications and targeted synthetic drugs are also used. While NSAIDs and steroids may relieve symptoms, they do not prevent long-term damage. Early treatment in rheumatoid arthritis can change outcomes and prevent irreversible joint destruction. To summarize, Osteoarthritis is a wear-related condition. It is common with aging. Pain worsens with activity, stiffness is brief, lab results are usually normal, and treatment focuses on pain relief and function. Rheumatoid arthritis is an autoimmune inflammatory disease. It causes prolonged morning stiffness, swollen joints on both sides, abnormal lab results, and it requires immune-targeting therapy. If you experience persistent joint pain, swelling, or stiffness, don't assume it's just arthritis. The type matters, and early diagnosis can make a significant difference. If you found this helpful, please like this video and subscribe for more simple, evidence-based health explanations. Thanks for watching, and I'll see you in the next video.